Hi, everybody. I apologize if the lighting is kind of funky. I'm working from the basement currently, so I hope that's not too much of a distraction. But let me go ahead and introduce myself. I am Dr. Andrew DeWitt, DNP, APRN, FNP-C. So I am a doctor of nursing practice, which is the highest degree that you can earn in the world of nursing. You have your bachelor's of science in nursing and your master's of science in nursing as well. So I kind of skipped over that middle one, so to speak. I'm also an APRN or nurse practitioner, and then I became board certified in family practice. So lots of letters after my name. I graduated in 2006 from Topeka West, which seems like ages ago. Now that I look back and kind of wrap my head around that factoid right there, Topeka West and its science curriculum absolutely had a huge impact on my career choice. I took practically every course available. These included honors and AP biology, and really I felt so supported by all of my mentors there. Um, but I definitely do have to credit AP biology for solidifying at least the sciency part of where I wanted to go in terms of career choices. So as I moved on to the collegiate level, I took some coursework at KU. I then transferred over to Washburn um, because of life stuff. And I applied for their BSN program. So I completed that in 2012. It was not a hard program, but it wasn't definitely not easy. Um, to make that happen, I had to take more biology, of course. The dreadful chemistry courses, which still give me PTSD. Um, Organic and physical chemistry just was awful, but you know, you do what you can. But probably the most exciting of all of those courses that were required was anatomy. I love anatomy. Hands down the hardest because there is so much to the human body, but that's what makes the human body fascinating. So I worked as an RN for going on about 8 years now as we approach the new year. Um, I applied to the DMP program in fall of 2015 at Washburn again and graduated in December of 2019. So about 8 months ago, 9 months ago. Um, Altogether, 8 years of higher education, which is a lot. I am done with school forever. Um, I passed the AANP, the American Academy of Nurse Practitioners Boards exam in February, which is very long and stressful. I do not ever want to take that exam again. Became board certified, like I said, in February, and then COVID happened, just out of the blue. Um, so finding a job really felt impossible for me until literally a week ago from today. I accepted an offer with a family practice clinic, and what really drew me to this position was the fact that the clinic was one of the first in the Kansas City area where I'm at to take on the HIV crisis and AIDS crisis back in the 80s. And I'll just kind of throw the clinic name out there if any of you would like to research it. It's the Sharon Lee Family Health Center. She is an amazing woman. She's done so much good for the world. And she still does. The clinic still does. So, along with seeing patients of all ages, because I am family practice certified, I'll also be trained to care for HIV patients as well as hepatitis patients, and then some of the transgender patient population, all of which I'm very passionate about. I What I love about being a registered nurse and a nurse practitioner is seeing patients from all walks of life. I love diversity. I love culture. So in my job as a nurse practitioner and what I did in residency as well, I assess, I diagnose, I plan and prescribe, um, and then I evaluate my patients' outcomes and hopefully help them achieve some success in whatever is going on, whatever is ailing them. So I could go on and on, literally, about NP stuff. If you guys have any other questions, I can give Ms. Volin my email and other contact info, whichever's easier. Please feel free to reach out. I would love to answer questions. I forgot to mention I was a clinical instructor at Washburn, so I did get to teach for 2.5 years, which was really awesome. But lastly, I want you guys to be well, be safe out there. The world is hard right now, but if we do what we're supposed to and we listen to science, we will get through it. So I hope you all have a wonderful school year, and thank you for listening to me. I hope to answer some questions. But again, take care. Bye-bye.